Hi everyone. Welcome to my channel where I explore fascinating topics related to psychology, neuroscience, and philosophy. Today, I want to talk about the brain and mind, two concepts that are often used interchangeably but have different meanings and implications. What is the difference between the mind and the brain? How do they interact and influence each other? And what are the functions of each? These are some of the questions that I will try to answer in this video, so stay tuned and let's dive in. To make it understandable, I will divide the topic into three main sections: brain, mind, and mind-brain relationship. 1. Brain. The brain is a term that refers to the organ that is part of the central nervous system and consists of billions of neurons and blood vessels. The brain is a physical thing that can be seen, touched, and measured using various techniques such as MRI or EEG. The brain is responsible for controlling many functions of the body, such as movement, breathing, heartbeat, sleep, and temperature regulation. The brain is also divided into different parts that have specific roles in processing information from the senses, generating emotions, forming memories, making decisions, and producing language. Some examples of the brain functions are: movement, the function of controlling the voluntary and involuntary actions of the muscles and organs of the body, such as walking, talking, swallowing, or breathing. This function is mainly controlled by the motor cortex and the cerebellum in the brain. Memory, the function of encoding, storing, and retrieving the information that is acquired through the mental phenomena, such as facts, skills, events, or habits. This function is mainly controlled by the hippocampus and the temporal lobes in the brain. Emotion, the function of generating and regulating the affective states that accompany the mental phenomena, such as joy, sorrow, anger, or fear. This function is mainly controlled by the limbic system in the brain, which includes the amygdala, hippocampus, hypothalamus, and thalamus. Decision, the function of making choices among alternatives based on the mental phenomena and their outcomes. 2. Mind. The mind is a term that refers to the mental phenomena that arise from the brain, such as thoughts, feelings, perceptions, memories, imagination, reasoning, and consciousness. The mind is not a physical thing that can be touched or measured, but rather an abstract concept that describes our subjective experience of reality. The mind is influenced by both internal factors, such as genes, hormones, and emotions, and external factors, such as environment, culture, and social interactions. The mind is also capable of changing the brain through learning, meditation, or therapy. Some examples of the mind functions are: thinking, the ability to form, manipulate, and evaluate mental representations of information, such as concepts, propositions, images, or symbols. Feeling, the ability to experience and express emotions, such as happiness, sadness, anger, or fear. Perceiving, the ability to receive and interpret sensory information from the environment, such as sight, sound, smell, taste, or touch. Remembering, the ability to store and retrieve information from the past, such as facts, events, skills, or habits. Imagining, the ability to create and explore mental scenarios that are not based on reality, such as fantasies, dreams, or hypothetical situations. Reasoning, the ability to draw logical conclusions from premises, evidence, or rules, such as deductive reasoning, a type of logical thinking that starts from general ideas and progresses to specific conclusions. Inductive reasoning, a type of logical thinking that goes from specific observations to general conclusions. Abductive reasoning, a type of logical thinking that involves forming a best guess based on incomplete information. Consciousness, the ability to be aware of oneself and one's surroundings, and to reflect on one's own mental states and processes. 3. Mind-brain relationship. The mind-brain relationship is a term that refers to the interaction between the mental phenomena and the neural activity that underlie them. The mind-brain relationship is a complex and controversial topic that has been debated by philosophers, scientists, and religious thinkers for centuries. Let me explain the mind-brain relationship with some examples from different perspectives, such as psychology, neuroscience, and philosophy. Here are some of them. Psychology. One example of how the mind and brain interact is the phenomenon of cognitive dissonance. which is the mental discomfort that arises when a person holds two or more contradictory beliefs, values, or behaviors. For instance, a person who smokes may experience cognitive dissonance if they also believe that smoking is harmful to their health. To reduce this dissonance, the person may either change their behavior, quit smoking, change their belief, deny the health risks, or justify their behavior, smoke only occasionally. Cognitive dissonance involves both the mind, the mental phenomena that create the conflict, and the brain, the neural activity that generates and resolves the discomfort. Neuroscience. Another example of how the mind and brain interact is the phenomenon of neurofeedback, which is a technique of using sensors to monitor physiological signals from the body and learning to control them voluntarily. For instance, a person who suffers from anxiety may use neurofeedback to regulate their brain waves. By observing their own signals on a screen and receiving feedback from a therapist or a device, the person may learn to calm themselves down and reduce their anxiety. Neurofeedback involves both the mind, the mental phenomena that influence and are influenced by the signals, and the brain, the neural activity that produces and responds to the signals. Philosophy. And lastly, how the mind and brain interact is the phenomenon of free will, which is the ability to act according to one's own choices and preferences. For instance, a person who decides to donate money to a charity may exercise their free will by choosing to do something good. However, some philosophers argue that free will is an illusion and that our actions are determined by our genes, environment, and brain states. According to this view, the person who donates money may do so because of factors that are beyond their control, such as their personality, upbringing, or mood. Free will involves both the mind, the mental phenomena that reflect and express our choices, and the brain, the neural activity that constrains and enables our choices. How does the brain produce the mind? This is a question that tries to explain how the physical activity of the brain can give rise to the non-physical phenomena of the mind. There are different theories that attempt to answer this question, such as dualism, materialism, idealism, and emergentism. Dualism is the view that the mind and the brain are two separate substances that interact with each other. Materialism is the view that the mind is nothing but a product of the brain, and can be fully explained by neuroscience. Idealism is the view that the mind is the only reality, and the brain is just a manifestation of it. Emergentism is the view that the mind is a higher-level property that emerges from the complex interactions of the brain, but cannot be reduced to it. How does the mind influence the brain? This is a question that tries to understand how the mental phenomena can affect the neural activity, and change the structure and function of the brain. There are different examples that show how this can happen, such as neuroplasticity, neurogenesis, and placebo effect. Neuroplasticity is the ability of the brain to reorganize itself and form new connections in response to learning, experience, or injury. Neurogenesis is the process of creating new neurons in certain regions of the brain throughout life. Placebo effect is the phenomenon of experiencing positive outcomes from a treatment that has no active ingredient, based on expectations or beliefs. How does the mind-brain relationship affect our behavior, health, and well-being? This is a question that tries to explore how the interaction between the mind and the brain can have implications for our actions, emotions, and quality of life. There are different ways that this can happen, such as cognitive behavioral therapy, mindfulness meditation, and biofeedback. Cognitive behavioral therapy is a form of psychotherapy that aims to change negative thoughts and behaviors that cause psychological problems. Mindfulness meditation is a practice of paying attention to the present moment without judgment, and cultivating awareness, compassion, and acceptance. Biofeedback is a technique of using sensors to monitor physiological signals from the body and learning to control them voluntarily. That's all for today's video. I hope you had fun watching it. If you have any questions or suggestions, please leave them in the comments section below. Hope to see you in the next one. Thanks for watching.